This is a demonstration of the Blanketrol 2 cooling blanket that is typically seen outside of the ICU. This device does require a physician order. Once the order has been entered into Meditech, if it is during business hours, the machine can be obtained via distribution staff. It is after business hours, the machine can be obtained by calling the AOD and having it brought to your location. Once the machine arrives at your location, there's a couple key points to point out. In the front compartment, there are going to be three things that you're looking for. The first is the cable for the temperature probe. The second being the temperature probe itself. This specific temperature probe is a rectal probe. A patient could also have a temp sensing Foley. Most of those are going to use the same cable. There is a separate cable option that uses a phone connector. If that is needed, that can also be obtained by calling distribution staff or the AOD. And the third thing being a bottle of baby oil. The purpose of the baby oil is to create a barrier between the patient's skin and the actual cooling blanket to assist in preventing cold injuries. For the machine itself, you have a toggle switch on the front for on and off. You also have a toggle switch on the front to go between Celsius and Fahrenheit. Moving along the side, you have quick couplings to set up and connect the cooling blanket itself to the machine, as well as an indicator to indicate forward water movement. These devices are very effective in all patient population, including bariatric patients. However, if there's ever a question about the movement of water to ensure that the machine is actually working, you can simply look in the window to observe the pinwheel to make sure that it is actually moving to indicate that there is forward water movement. The last thing is the water level itself. Water is poured into the reservoir. These jugs of water are distilled water and can be obtained from the 5th floor stockroom or from distribution. Once the blanket is on the patient and therapy is ready to be initiated, everything is fairly straightforward. You'll utilize the on-off toggle switch on the front to turn the machine on. The machine's then going to prompt you to set your temperature set point. You'll choose temperature set. Typically it's going to default to 37 degrees Celsius or 98.6, which was typically what we think of as being normothermic for a patient. You have three different modes you can choose from. Manual control simply controls the temperature of the water. It does not take into consideration any patient involvement. Auto control will utilize the temperature probe, and it will auto titrate the water temperature to best get the patient to the current set point. And then the third option is monitor only, which simply just takes the patient's temperature without circulating any water. So we're going to choose our set point. If for some reason we needed to choose a different set point, we simply toggle up and down via the up and down keys. And we're going to choose auto control. This is what you're going to use almost 100% of the time on our patients. We choose auto control, and the machine will simply titrate heating versus cooling to get our patients to the current set point. Once our patient is no longer needing therapy, and we want to keep the machine present in the room just to monitor the patient, we can simply hit monitor only. Just another couple care points to mention. It's important to maintain a barrier between the cooling blanket and the patients themselves. Best practice is to place the cooling blanket on the bed, followed by a flat sheet, and then any dry flows that the patient may need based upon their care. It's also important to ensure that they have an adequate amount of baby oil on their back, typically from the base of their neck to the top of their knee. This works to reduce cold injuries such as frostbite, 2nd or 3rd degree burns, and necrosis that can occur from long-term use in this device. Again, this does require a provider order. It's typically used only in patients who are refractory to antipyretic therapy such as Tylenol or Motrin. and have a fever of greater than 102 for a sustained time. Once the order is entered into Meditech, it will place an intervention for documentation on the work list as a BID assessment. And of course, you can assess further if needed based upon patient condition, just basically checking the skin. If you have any questions, feel free to reach out to the education team or myself.